Do you need help with marketing, new clients, or online reviews? Massage Book is your solution, streamlining all the challenging aspects of your massage therapy practice. This powerful software simplifies scheduling, payments, and marketing, allowing you to focus on what you do best, helping clients live better. Plus, sign up now with code ABMP50 and get $50 off after your free 30-day trial. Visit massagebook.com, create an account, and transform your practice today. That's Massage Book with code ABMP50 for $50 off. Don't wait. Give it a shot today. Are you looking for a company that empowers your growth and development? Look no further than the Elements Massage brand, where all massage therapists have the opportunity to thrive through the Elements Massage Career Advancement Program. In the Elements Massage Career Advancement Program, Elements Massage Studios recognize, reward, and uplift their massage therapists, rewarding continuous learning, commitment, and growth. The Elements Massage Career Advancement Program includes professional, elite, and master levels, where massage therapists will enjoy higher commission rates, access to continuing education and development opportunities, and unique career growth opportunities to propel them toward a successful future. Evaluate your career and apply to an Elements Massage studio today. Visit elementsmassage.com/careers and take the first step towards a fulfilling journey. That's elementsmassage.com/careers.
Hi, everyone. Welcome to the ABMP podcast, a podcast where we speak with the massage and bodywork profession. I'm Rachelle Clauson.
And I'm Nicole Trombley. Rachelle and I are longtime massage therapists, and we write the Anatomy for Touch column for Massage and Bodywork magazine. And we just finished recording a new course for the ABMP CE library called Understanding Fascia's Role in Low Back Pain. Be sure to check it out. We think you'll like it.
And when we aren't writing or massaging, we're busy studying in the dissection lab and teaching. We are the co-directors of AnatomySCAPES, a continuing education company for hands-on professionals.
Our next workshop is coming up in a few weeks, and we just had our pre-workshop Zoom call with all the amazing bodyworkers who are flying into San Diego to spend 3 days with us in the lab.
And on the massage tables with a newly added third day for hands-on applications. We will be joined by guest teacher and ABMP writer, podcaster, and Rebel Massage YouTube extraordinaire, Allison Denny.
This in-person dissection course is our flagship workshop called Journey into the Matrix. It's a deep dive into the structure and organization of the fascial system, designed especially for hands-on therapists. Mm-hmm. Our upcoming October class is sold out, but if you click on the link in the show notes, you can find out how to get on our waiting list for our next lab workshops.
And the reason we're so passionate about bringing massage therapists into the dissection lab has everything to do with today's topic, understanding tissue relationships, your practice in 3D.
If you've already listened to our first 2 episodes in this 3-part series, then you've got a good understanding about how exploring anatomy in the dissection lab has been so essential in helping us with seeing anatomy in 3D and feeling anatomy in 3D by clarifying our understanding of the tissues we touch.
And of course, if you missed either one of those podcasts, don't worry. You can just go back to them before or after listening to this next step in our thought journey. Look for episodes number 415 and 439. Okay, so today we're diving into a topic that can easily be missed, but is under our hands every time we give a massage. Today, we are talking about tissue relationships, because anatomy for the massage therapist means so much more than just identifying where our parts are. We need to know how they are connected to each other.
But first, let's start with a quick anatomy word association game.
Ooh, I love games. Okay, let's do it.
Okay, I'll say an anatomy word, and you respond with the first thing that comes to mind. And then I'll respond, and so on. We'll go back and forth.
So is this like looking for the opposite or a word that means the same thing?
Either one. Just the term that first comes to your mind as a matching idea. And listeners, feel free to play along at home. You ready?
Ready.
Okay. Inferior.
Superior.
Above.
Superficial.
Deep.
Below.
Foot.
Plantar.
Palmar.
Distal.
Proximal.
Okay. Anchored.
Gliding.
Aha!
Okay, that last one was a bit of a departure. Anchored and gliding are concepts that probably aren't covered in most anatomy classes.
And definitely not on any certification exams that I've taken, but they're exactly what we're talking about today. Tissue relationships. How is the anatomy we know connected to each other?
The standard anatomy vocabulary, like anterior, posterior, gives us tools to communicate with other professionals and describe what is where in the body. So that if I say that gastrocnemius is superficial to soleus, we all understand what that means. Yeah, for us massage therapists, our hands encounter a more nuanced story in bodies that do more than just hold a pose like the ones in our anatomy charts. These bodies move.
So true, right? That's right. And our hands are not just feeling where our client's anatomy lives, but rather how their anatomy relates to each other. And the quality of relationships between tissues becomes really important. Gastrocnemius isn't just superficial to soleus. Gastroc's deep surface glides over soleus when it moves. It's essential for healthy movement, and we can actually feel that gliding relationship with our hands.
I hadn't ever really thought much about tissue relationships until we really started exploring in the dissection lab.
Right? Like you go into the lab thinking that you're going to see all these structures that you studied in anatomy class, but the act of dissecting itself is about separating tissues to isolate structures. And when you separate, you become quite aware of how things are connected. Relationships. To this day, I'm still learning about all the areas of connections that can't be shown in the anatomy books.
It goes way beyond insertions and origins.
Which isn't as clear-cut of a thing as we might believe either.
No, it's not. The transition between muscles and bones is a complex picture. But all these relationships, like anchored and gliding, are about connections. So in today's conversation about tissue relationships, Rachelle and I are going to explore with you the relationships we find both in our work in the dissection lab and in our clients' tissues.
First, we will examine surface connections from our point of contact at the level of the skin and subcutis.
Second, we'll look at deeper connections at the level of muscles and deep fascia.
And then we will conclude with some ideas about how all this shows up in our massage practices and what that means for you. So as we explore connection, Nicole, what is the tissue that makes all these connections possible?
No big surprise, we're talking about connective tissue.
I love it when names make sense.
I know, me too.
So what exactly is connective tissue?
On a technical level, connective tissue is one of the 4 types of tissue in the human body: muscle, epithelial, nerve, and connective tissue.
We actually wrote about these tissue types in the May-June 2024 issue of Massage and Bodywork magazine in our Anatomy for Touch column called Thinking in Tissues. We'll put the link in the show notes.
Connective tissue encompasses a lot of different things in the body, including all the collagen-based tissues that can be loose or dense, thin or thick, membranous or globby. It's a lot.
And all these connective tissues, including fascia, have often been dismissed with a pretty unremarkable role as mere filler. The bubble wrap, the packing material, the stuff in between the things and around the muscles and bones and nerves and vessels. While these tissues really do fill in the gaps, they're also creating an entire scaffolding for the human body and form the basis of the textures we feel with our hands. The softness or toughness, the smoothness or bumpiness. They create the dimpliness of cellulite, the ropiness of our tendons, the grounded firmness of our bones, and even the elasticity in our skin.
Yes, this is really why we talk about fascia so much here at AnatomySCAPES. But it's not a trend. It's our anatomy.
And it is mind-blowing how relevant this is for massage therapy.
It defines so much of what we're feeling under our hands, those textures you were just describing, and it also defines how the tissues move under our hands. Do a nice engaged effleurage in the back, you can see and feel the muscles, like trapezius, moving under your hands. It's connective tissue that allows the fat, muscles, tendons, nerves, and blood vessels to move and distort under your stroke.
And then spring back. And when you want to go a little deeper than trapezius, you start to engage a deeper layer like rhomboids, for example. You add a little more pressure to your touch, change the vector or direction, all the while trapezius is still in the story, happily moving over rhomboids, because where it's free to move, it glides in relationship to the rhomboids underneath. All our muscles require glide where they interface with each other. Otherwise, they would bring the neighboring muscles along for the ride when they contract, and this would be exhausting and also not very functional. We should interject here that when we use the term glide, we're using it in the common way that most of us understand. But in more scientific terms, the movement is actually usually called shearing. Shearing happens both three-dimensionally within a tissue and between tissue planes, and the fascia is always involved.
Fascia creates the anchors and brings the glide.
Well, let's look now at tissue relationships at the level of skin and subcutis and see what we can feel on these surface connections from surface to deep.
One of our favorite ways to explore anchored and gliding is quite literally in the palm of our hands.
You know what? Let's do our palpation exercise for that. Listeners, you can try this on your own hands, unless, of course, you're driving. Please keep your hands on the wheel and do it later.
Safety, safety.
Right.
Okay, so using the fingers of one hand, touch into the skin of your opposite palm. Try connecting just with the more superficial layers and see if you can move the skin back and forth. You want to keep your movement slow so you can note how far the skin moves. And although you're just moving the surface tissues, think about depth. Your hand is three-dimensional. How is this surface movement translating to the deeper layers of your hand? Can you feel it? Can you feel movement down deeper at the palmar fascia? What about to the bones? What can you feel?
So now let's try something similar, but on the back of the hand. Using the same quality of touch, see if you can glide the skin of the dorsal hand back and forth. How far does that move? And how deep does that movement translate? Can you feel this one in the deeper layers? All the way to the bone?
It's so different.
It is.
So the skin on the palm of your hand is more strongly anchored to the deeper layers. The skin, along with the subcutaneous fat, is densely packed with connective tissue, strongly adhering to the deeper fascia. Super anchored, super stable.
And for good reason. We don't want the skin of our palm sliding all over the place. Think about it. Holding anything would be difficult.
And dangerous, right? Pick up a mug of hot coffee with unanchored skin. Not a good idea.
That's called coffee on the floor. The back of the hand is organized a little differently, though, right? In a way that is also important for gripping. By allowing a little more gliding on the back of the hand, instead of anchoring, we have the slack we need to allow us to bend our hands around the shape of what we are grasping. Go ahead and make a soft fist as if you're starting to grasp something. Notice what happens to the skin on the back of your hand. The wrinkles around your knuckles disappear, and the skin slides to accommodate your hand folding into a fist. Instead of being strongly anchored to the deep fascia, this skin and fat layer can glide over the deeper tissues.
And it's not just those superficial layers that are gliding over the deep fascia. The tendons of the forearms that move our fingers so that we can make a fist, those are gliding within the deep fascia, so deep below. And all this gliding is facilitated by loose connective tissue, a type of fascia that's found wherever tissues need lubrication or glide.
Loose connective tissue. We see it all the time in the dissection lab at the interfaces between structures. Differing from the dense, tough fabric of dense connective tissue, what deep fascia is made out of, loose connective tissue is, loose and wet and gauzy and spiderweb-like with just an uncountable number of these thin, wispy fibers.
It's so gorgeous. But this is the type of fascia that Jean-Claude Guimberteau made famous with his Strolling Under the Skin documentary.
Yeah, and if you haven't seen this, listeners, and you're not familiar with his work, it is totally worth checking out. Guimberteau is a hand surgeon who uses endoscopic cameras to film his patients' tissues during surgeries, with their permission, of course. He has tiny cameras that go in between tissue planes where this loose connective tissue is prevalent and beautifully shows how things like the tendons and muscles glide and slide over each other.
It is stunning. Stunning. All right, so now we've looked at the tissue relationships of anchored and gliding at the more superficial layers. Let's go deeper and get a sense of what's happening with muscles. So when it comes to muscles, what are the points of anchored stability which allow a muscle to create movement? What comes to mind first? You're actually pretty familiar with the idea of tissues being anchored to each other, right? Origins and insertions.
Yeah, of course, bony attachments are the most familiar of these anchorings. But there's another kind. Muscles don't just insert and pull on bones. They also pull in specific ways on the complex three-dimensional network of deep fascia.
Fascia's at it again.
We were actually looking at an interesting example of this in the dissection lab just a few months ago.
Yes, that was a great one. Should we show them where to feel it?
Yeah, let's do that.
Okay, so listeners, if you reach one hand to the back of the opposite shoulder, find the spine of the scapula. And again, listeners, if you're driving, try this later. So back there, the traps are overlying supraspinatus and infraspinatus. Posterior deltoid is swooping in, inserting at the spine of the scapula. We're also going to find teres minor and major.
I always forget the long head of triceps brachii attaches to the lateral border of the scapula as well.
Yeah, me too. So as we're back there, we can start to make sense of what is where by mapping out which muscles are more superficial and which are deep, which is more medial, more lateral, so on. But it's never that clean and neat of a picture in real bodies. Tissues are missing from our thinking because often they're also missing from the pictures we study.
Yep. Adding fascia back in always changes the picture. This is the whole point of lab work as I see it. Seeing all the anatomy before it is cleaned up and neat and tidy for our labeled charts. When we look at the posterior shoulder, real anatomy, not the idealized illustrations, we see something kind of interesting. There is this white, collagenous, tough fascia on top of the infraspinatus.
Does it have a name?
It does. It actually is a pretty straightforward name. It's called the infraspinatus fascia. You can actually sometimes see it hinted at in anatomy drawings, although I've never seen it labeled.
This particular fascia changes up the story of what is where on the posterior shoulder. Even though our anatomy books and apps show us the muscles in this area as distinct and layered, there's a fascial continuity that we need to be aware of here.
The muscles actually converge and join with each other through the fascia on the superficial part of the infraspinatus. So traps, deltoids, infraspinatus, they're actually all anchored into this tough, dense fabric that you can feel.
I'm feeling for this all the time in my clients now whenever I'm working the posterior shoulder. Now that I've seen it and felt it, I can't unsee it or unfeel it. There's just an extra density right there. And as I'm working posterior deltoid, I feel it pulling on its anchor to the infraspinatus fascia.
Your hands are feeling it, but so are the neighboring muscles, right? The muscles are anchored to the infraspinatus fascia, but that also means they're anchored to each other. So whenever they contract, they're pulling into their bony insertions and they're pulling into the fascial insertions into the infraspinatus fascia. The other muscles can feel this too. It's like the muscles can talk to each other directly through this fascia.
Such an important point. When we talk about tissues being anchored, my first thoughts are always about stability and mechanical connections. But these muscle to fascia anchors help muscles convey information to each other. This is a big deal. These fascial connections are part of how our muscles communicate with each other and work in harmony with each other.
And if communication makes you think nervous system, you're right. Fascia is innervated. It has nerves. So definitely these muscle fascia anchors are not just mechanically connected stuff. They're neurologically active.
Do you mean to say that fascia feels?
I do. Muscle fascia connections exist all over the human body. It's a big part of how neuromuscular coordination works. Infraspinatus fascia is just one example of what is called a myofascial expansion, which is where muscles anchor to the larger fascial network.
This is so important, and these are not just obscure anatomy fun facts. On average, about 70% of a muscle's force is transmitted to its bony attachments. The other 30% to the rest of the fascial network through these myofascial connections.
That's crazy, especially since we barely even heard of them. I actually remember when this research was presented at the 2015 Fascia Research Congress in DC. It blew my mind.
It's so significant. The takeaway here is not all muscle contraction is to create movement.
Oh, can you say that again?
Not all muscle contraction is to create movement. A good portion of it is for the purpose of the body being able to communicate within itself what's happening when it moves. Of course, now, with the shoulder, we don't want to confuse anybody. The muscles on the posterior shoulder are not all glued and anchored to each other. That would not be pleasant at all.
Absolutely. It can't all be anchored together. Our tissues need the capacity for glide. Our ability to have any kind of complexity to our movements requires our muscles to be able to work together and independently. We need gliding as much as we need anchors.
Yes, and this is where the gliding between muscles comes in. Loose connective tissue, once again, provides the lubrication needed for a healthy, restriction-free function, which can sometimes be compromised if the loose connective tissue changes its viscosity.
And when would that happen?
The normal stuff: inflammation, overuse, underuse, and misuse.
Bingo. And massage helps?
Yep. Research is showing that the viscosity of loose connective tissue decreases with mechanical strain. Translation: it becomes more slippery when you massage it.
Aha. So massage affects the relationship between tissues, helping them glide when they are supposed to glide.
Yes, in the surface connections and in the deep. Okay, so we've given you a lot to think about, everybody. Now, what does it mean for you in your massage practice?
The more we start to think in terms of tissue relationships, the more we can strategically navigate our clients' massage sessions. Knowing where the body was meant to move within itself and where it is meant to be stable empowers you to gently encourage movement between tissue planes that should glide, decreasing loose connective tissue's viscosity, making your practice more of a melting story than one of trying to break things up.
And when a more long-term tissue change is developed, as in the case of scar tissue, we've got a better map to perceive the relationship change where anchors or adhesions have developed where tissues used to glide. Our hands can feel this change.
Better understanding tissue relationships has truly been one of the biggest gifts from my dissection work to my massage practice. And if you, the listener, spend some time in the anatomy lab too,
yes, please come consider joining us for a workshop.
Then your practice may change as well. Because once you start understanding tissue relationships within human anatomy, you will likely enjoy experimenting and weaving new touch approaches into your clinical work based on your new and improved understanding.
Well, as much as we just covered, I'd still have to say this has been more like Tissue Relationships 101, because there's so much more to the story.
Agreed. The complex weaving of three-dimensional structures of muscle, fascia, and don't forget nerves and blood vessels, well, they all have specific ways in which they relate to each other. And gliding and anchoring are not always specific quantifiable terms. They exist on a spectrum.
So much to discuss.
So little time.
Which really is part of why I love my work. As much as I learn, always something more. I'm never bored.
Same here. If you'd like to share your thoughts with us about this episode, please email us. You can reach us at info@AnatomySCAPES.com. That's like landscapes, but for anatomy. AnatomySCAPES.com.
All right, that's all for now. But be sure to head over to the ABMP CE Center and check out our new continuing education course, Understanding Fascia's Role in Low Back Pain. I'm Nicole Trombley.
And I'm Rachelle Clauson. Thank you for listening.